Hello, my name is Sofia Zapata. I'm part of the AME program of Northwest College Riverside, and today my homework is on injections. Today I'm going to be showing you how I will perform how to do an injection on a patient for intradermal, a subcutaneous, and intramuscular. So those are all different injection sites. They are very different, and they will also need different gauge needles. So before you do any of those things, you need to make sure that you get your equipment and supplies for the injections, and also that you verify the patient. Also, you verify the orders. You make sure you check them at least 3 times. Make sure that the order is going for the right patient. So let's get started with the equipment and supplies. For the intradermal, I'm gonna show you how to perform that one first, and then we will move on to the other 2 injections. So for those, you're going to need a patient health record. You're going to need the provider's orders, which is the records provider's orders. I'm sorry. You need the drug name, the strength, the dose, and also the route of administration. You need the vial of tuberculin PPD. You need gauze squares. You need alcohol wipes. You need the 27 gauge needle. You need disposable needles, a sharps container, a biohazards bag where the disposable gloves will go. And you also need a written patient instruction for a follow-up, because you will need to ask the patient to go back in 48 to 72 hours to check for any reactions. So after you have gathered all the equipment and supplies, it is time to inject the patient. And don't forget to greet and verify. So let's move on with that. So after you have gotten all your equipment and your supplies, you are going to start not injecting the patient yet, but you are going to prepare the medication in a well-lit area. You're going to get the equipment, then you're going to sanitize your hands. You're going to compare the order with the vial and check for any expirations. You want to make sure that those medications aren't expired, or it will cause pain or worse things to the patient. So if the medication is expired, you throw it away and you get a new medication. But they shouldn't be expired, because they should always be checked. But anyway, you want to make sure anyways, because anything like that can just slip. Then you want to withdraw the correct dose. So again, you want to make sure that you at least check the order 3 times to make sure that that is the correct dose for the patient. You are going to ask the patient if they have ever tested positive for tuberculosis. That way you want to let the provider know before you administer the medication. If not, you can proceed with the injection and everything else. When that happens, you are going to, well, not when that happens, after you have asked the doctor, or the doctor has let you know what you can do. If the doctor lets you proceed, then you want to put on the gloves, and you want to select a site for the injection. So for a intradermal injection, the injection will go on the patient's forearm, to be exact, because you want to, after you document in the patient's health record, you are going to also put the exact site where you injected the patient. So for an ID, you are going to inject the patient in the, okay, I have it right here because it's kind of hard to say it. But you are going to, you are going to, so several finger widths down in the mid anterior aspect of the forearm. So if I were to put my hand, it would be somewhere around here. So let me see. Somewhere around here, like towards the middle. I think somewhere around here. In the mid anterior aspect of the forearm. Mid anterior. That's where you will be injecting the patient. You want to avoid any scars or any discolored pigmented areas. After that, you want to loosen the needle cover. And then you want to open the alcohol wipes. And this is where it gets kind of fun. You want to stretch the skin down. When I'm the medical assistant, right? I will be on this side. And I would stretch it with my 2 fingers and my thumb. I would stretch it all the way down so that I can inject where I'm going to inject the site. But first, I'm going to clean the area, and also I let it air dry. I do not want to touch the area after cleaning the site. After I have cleaned the site, I'm going to inject the medication at a 15-degree angle. When I inject it at a 15-degree angle, I will not push all the needle all the way in either. It will only go halfways, and it will be at a 15-degree angle. 15-degree angle, 45 and 90-degree angles all the way here. Those are different selections for different injections. After that, I'm going to inject it, and a wheel should pop up. When that happens, I'm going to withdraw the needle. Then I'm going to dispose of my syringe into the sharps container. I'm going to get rid of my disposable gloves in the biohazard bag. I'm going to also check the patient for any adverse reactions. Then I'm going to sanitize my hands, and after that, I'm going to document everything in the patient's health record, and I'm going to also, like I said earlier, let them know to come back in 48 to 72 hours to check for any reaction readings. And that would be the end of injection performance. Now let's move on to the subcutaneous. Okay, so for a subcutaneous injection, you also need the equipment and supplies. And let me re-say them again just so that I can also remember them. And so that I can get better at this. So you will need the patient's health record. You need the physician's orders. No, you need the physician's medication order. So you need like the strength, the dose, the drug name, and the route of administration. And then after that, you will need disposable gloves. You need a sharps container. You need a biohazard bag. You need gauze squares. And you need the tuberculin vial of PPD. And you will also need, for a subcutaneous, it won't be a 27 gauge needle. You need a 25 gauge needle for that. And also the written, oh no, you don't need that. That is for the intradermal. You need cotton balls for the subcutaneous because you will need to put cotton balls after the injection for the patient. That is only for the subcutaneous, and I think also the intramuscular, but not for the tuberculosis. You don't touch that one at all. So you also need the vaccine information sheet for the varicella for the subcutaneous. So after that, when you completed all that, for the intramuscular, I won't be letting you guys know what you need for the equipment and supplies because it's just it's pretty much the same things, but some things are required for the subcutaneous and some other things are required for intramuscular, but it's usually the same equipment and supplies. So after you have make sure that you have all your supplies, you are going to get the medication and you are going to prepare it in a well-lit area. You are also going to check the orders like 3 times. You always want to make sure that you give the correct dose and the correct strength to the patient, or else you could end up in court. So let's get it on. After that, if any of the refrigerated container is in the fridge, you want to warm it up by gently rolling it like this with the palm of your hands. After that, you will want to prepare the syringe and withdraw the correct medication, the correct dose. Then you want to greet and verify your patient. You want to make sure that is the correct patient by verifying their name and date of birth. You are going to ask the patient to sit upright. And you are going to, these are my favorite parts. You are going to inject the patient on the forearm, not the forearm, on the shoulder, the upper posterior arm. That is the correct term for the injection site. That is what you're going to put on there. Then after you locate where you are going to put it, where you are going to inject the patient, you want to make sure they're sitting upright. You loosen the cap of a needle. That way it's easier for you. You are going to put on your gloves. Then you are going to grasp the skin to make a fold, just like this. But it will be this way because you are going to do it this way. After, you are going to insert the needle at a 45 degree. It depends what kind of needle you use, because other needles you will need to do at a 90 degree. So depending on the needle that you use, either it's a 45 degree or it will be a 90 degree. After you insert it, 45 degree, 90 degree, you apply pressure with gauze after withdrawing the injection. Then you are going to dispose of your syringe into the sharps container. You are going to dispose of your gloves in the biohazard. And you're going to record the drug administration and the patient's health record. You're going to make sure that the patient is comfortable, that you answer any other questions. And also, you want to sanitize your hands, wash your hands after that. And I just wanted to say out there that each facility has a policy for a documentation vaccination. So when I go to a facility, they will let me know how they roll there. But now let's move on to the intramuscular. So let's move on to the intramuscular. That one, you also need your supplies and your equipment. You want to make sure that you check the orders at least 3 times, the strength, the dose, the medication, the right needle, and all that, because you do not want to injure a patient or you could be in very bad trouble. So you always want to make sure that you check all those doses and strengths and the correct dose. So after that, you want to ask the patient as well if they are allergic to penicillin, any other antibiotics, just to keep the patient safe from any harm from a medical assistant. So after that, you're going to help the patient in an upright position. I've actually done these injections, the intradermal, the subcutaneous, and the IM. I've done all of them. But with the intramuscular, I did it in the upper right hip. So in the upper hip, either left or right. But it shows in my book that I can do it in the deltoid and here in the shoulder, the leg. But I'm going to be showing you how to do it in your upper hip, because that is how I was shown. But I know I can do it here too. But let's just go ahead and get on with it. So after you have done asking the patient for any allergic reactions, you want to put on the gloves. Then you want to expose the upper hip. Then you're going to loosen the needle after everything, you have assembled everything. You're going to clean the patient's upper hip in a circular motion. So always just don't forget, ma'am, can you please put your pants down? I'm going to, check for the site. It's going to be in your upper hip. After you've done that, you've located the site. You want to make sure that you take the needle off. Then with your non-dominant hand, you also want to touch the patient's back to let them know that they are going to get injected ASAP, as soon as possible, right? And for this one, you're going to inject at a 90-degree angle. It'll be almost like throwing a dart. You're going to grasp the needle with your hand, and you are going to inject the patient like if it was a dart, just at a 90-degree angle, which would be like this. It's just straight. So after that, you are going to aspirate slowly. When you aspirate, you want to make sure that no blood comes out, because if blood appears, you're going to have to restart the process. You're going to get a whole different syringe, dispose of the other contaminated one, and just do the whole thing. So you want to make sure that you are very, very careful. If the blood doesn't appear, then of course you're going to put a cotton ball on top of the syringe and slowly take out the syringe to keep the cotton ball in place. Then you're going to massage gently with the gauze square. You're going to dispose of your gloves and in the biohazard, and you are going to sanitize your hands. At the end, don't forget to document the dose of the medication, the date and the time, and don't forget to document any of that. Watch the patient from 20 to 30 minutes to observe if they are feeling all right after the injection. Answer for any questions. And yeah, those are my three, well, not performances, but the way I'm learning how I would do a performance in my head for a patient. And so far I think I'm pretty good at it. I just need to keep doing it, and if eventually I'll get better. So thank you so much for watching, and this was my homework for this week. Thank you.